Welcome to the Purr Podcast, your favorite feline-focused podcast, where we dive into all things feline, medicine, surgery, behavior, and of course, a sprinkle of veterinary gossip along the way.
I'm Dr. Joya Griffin, feline fanatic, surgery nerd, and self-proclaimed lover of all things awkwardly cat-related.
And I'm Dr. Susan Little, proud cat vet, podcast enthusiast, and your guide to the wonderfully weird world of feline medicine. Let's get started. Hi, this is Dr. Susan Little.
And Dr. Kelly St. Denis.
Do you know what? Don't you think I do better without
You're
Yola?
doing a great intro. No pressure from Yola at all.
That's the problem. Yeah. Yola's the problem. Yeah. I've done well too. We've taped 2 things in a row.
Yeah, you've been great doing your intro.
Well, that's just it. It has to be permanent. No more Yola.
Yeah.
So we're back with Dr. Griffin. And you know Yola, I think, right?
I do. I've been able to work with him through Hills.
Tell us a Yola story that he wouldn't want heard.
I mean, I don't know. I mean, Yola, I run into him a lot at the different conferences, and he's just always full of so much joy, and then every now and then Chippy pops out. So that is always so exciting when he's there, and sometimes I ask for Chippy first.
Yes.
And he's like, well, Joya, he's not here this time.
Nice to see you too.
Yeah, nice to see you too.
Well, yeah. You're okay, Yola, if Chippy's not here.
Yeah.
And Chippy's an honorary cat because he's come to the AFP meetings before, and I dubbed him an honorary cat when I was president.
I think he is a cat-like dog.
Yeah,
he's smaller than most cats.
Yes,
actually. Yeah. I bought him. So I'm from Nova Scotia, where there is a lot of lobster. And once I bought him a lobster dog toy, only to realize when he got it that the toy was bigger than Chippy.
So that's very easy to do, though.
Yeah. So we left off last week with a bit of a cliffhanger because our guest, Dr. Joya Griffin, has done some TV shows.
I have.
So what one came first?
So we did Pop Goes the Vet. It's an 8-episode...
Pop Goes the Vet.
8-episode series. I didn't choose the name. That came to me from Nat Geo. We didn't have a lot of liberty to change the name, but they wanted something that would sort of be the animal version of Dr. Pimple Popper, if anyone's familiar with her. And so she has patients come in. They've got grotesque cysts or tumors, things like that, and she'll pop them, pull nasty things out on people. Like it's like watching a train wreck where you're like looking between your fingers and you don't really want to see, but you can't turn away. You can't do it.
I can't.
I actually do like it to some degree.
Yeah, but you're a dermatologist.
Yeah, you're right. Yeah. So like we like, the grosser the better. The one thing that kind of bothers me more than anything in derm is sometimes the smell. But I've become nose blind over the years. So my students will say, oh my God, that's so bad. And I'm like, nah, that doesn't really smell that bad. But so it has to be really high level stink for it to be offensive to me. Yeah. Really high level. But usually the visual doesn't bother me much at all.
Yes, you're a dermatologist.
Yes.
And this is why I'm not a dermatologist. Yeah. So what type of cases, were there any cat cases?
There was. We had a cat, and I think either episode 3 or 4, named Bean Dip. And Bean Dip had cystadenomatosis, and so, the little bluish colored cysts in the ears, and had a couple little cystic masses on the head that we removed and cut into, and had some nice nasty fluid inside.
Yeah, that probably looks pretty dramatic to people who aren't vets, right? Yes. So small segue, what do you do for those cases? Because you've seen them. Yeah.
Nothing, or you could do a laser ablation if they're really occluding the ear canal. If they're not bothering the cat, a lot of times we don't treat them at all. Sometimes if they're a little occlusive and the cat's prone to getting, overgrowth of bacteria or yeast, we'll just, start a cleaning routine, maybe treat the inflammation a little bit with a topical steroid, and then if they get really severe and they start occluding the canal and you can't get rid of the infection, then we'll do a video otoscopy procedure. And then what's really cool is I have a laser that fits through my scope, and I can blast
What is
little
video otoscopy?
Video otoscopy.
Video otoscopy.
Yes.
Oh, yeah.
Video otoscopy.
And you have a tiny laser.
Well, it's a big laser, but there's a tiny little,
True.
It's a tip that goes and fits through the otoscopy. So through our scope, and then there's a little port on the side so your laser can go through there and then you can see what you're doing exactly and ablate right at the area that you need ablated.
It's amazing.
Yeah, it's pretty cool.
That's pretty cool.
That's crazy.
It's fun. That's really fun.
Oh,
it's really
look at what
fun.
we miss out on. I never get to do stuff like that.
It's kind of like watching a video game, though, because you're looking at the camera and then you're like, do-do-do-do-do-do. Like it just has we really get excited over otoscopy.
Oh, you need to have music that goes with
yes,
it, right?
we do.
Yeah.
We really do.
Oh, that's crazy. Do owners ever get a chance to see it? Like, do you record any of it?
It does have a video on it, so we can show them the videos and the pictures, and then of course, like the before and afters are always really beautiful.
Oh my gosh, that's crazy. Crazy.
Yeah. Do they recover well, or do they get more after the fact?
Most of the time, if they're really severe like that and you ablate them once, it doesn't really recur. There can, of course, anytime you ablate tissue inside an ear canal, because of the cartilage and how it's poured to heal, you can end up with some scarring. So that's always, a little bit of the concern. But with our laser, we haven't really had that issue.
Any idea what causes them?
It's more of just kind of a hereditary thing in
That's
some cats.
That's what I've suspected that.
I do think that if there's more inflammation, I do think those cystic types of tumors can become more proliferative, especially in, we're all familiar with Cocker Spaniels and how they end up with all of that seminal gland hyperplasia, and then the more inflammation that's there, the more that occurs, and so it could be that the cat has them and then they get inflammation and then they get more, because the body will do that and start to
see how she did that. She said Cocker Spaniel, not the D word.
Yeah,
well done.
That was good.
Well done. Yeah.
She also worked in the inflammatory cat thing that you always like to
I do.
That cats are very inflammatory.
They really are.
That's their first response to anything, isn't it?
Yeah.
Yes.
Inflammation.
Yes.
Yeah.
It really is. I mean, they have so much. Their skin disease is just so interesting to me, especially with allergic disease, because we know a lot about it in other species, but with cats it's just we don't know a lot, and they're hard to study, and with allergic disease there aren't as many papers, so then we call it like feline allergic skin syndrome instead of atopy or a specific disease. And they present with all these weird reaction patterns with eosinophilic granulomas and plaques and indolent ulcers, but then sometimes they just scratch their faces off, and so they do a lot of interesting things with their allergic disease, and I think that can be confusing and it can be challenging and
frustrating,
and probably why the meds don't work as well, because it is a syndrome and it's not really
like
one disease.
And clinical signs overlap a fair bit, don't they? I think that's a diagnostic dilemma.
They do often overlap. You have a cat that is itchy, but then it also has miliary dermatitis, or it has an eosinophilic plaque, and sometimes they don't do them at the same time. Or one year they may have one presentation and the next year might do something completely different. So then as clinicians, we think, this has to be something else. Like, it's not the same process going on.
Yeah.
So,
do any other species get eosinophilic plaques?
So it is pretty unique to the cats, but you can see them in other species. Miliary dermatitis, though, I do not believe has been reported in any other species than cats. That specific reaction pattern, but you can get eosinophilic granulomas in other species. But the cat likes to do it in a very powerful way.
Such a curious lesion, really, isn't it?
It really is. It's very scary.
Yeah.
It makes you think, oh, maybe this is neoplastic, or maybe it's more immune-mediated. Like, you really don't know, because it can look grotesque, and they are usually spontaneous. Like, the cat can't create those really perfect plaque-like lesions. They do lick them after the fact that they're there, but it's really...
I've
seen some lesions in the mouth that I think are eosinophilic plaque.
Yes.
Yeah. I once had one it was an older cat, I think he was 10, came in, I was sure it was a tumor on his soft palate, and the owner wanted me to do something. I resected the soft palate.
Nice.
Sent it out, and it was an EGC.
Yes.
It wasn't even a tumor.
Yes.
Well, it didn't come back.
No.
It didn't come back. Yes, so that's a good point.
He was fine without a soft palate for the remainder of his days. And we kept him on steroids.
Yeah, surgery. I mean, that is a good point. Like, cats, I always look in their mouths, which we should do as clinicians, but my cat derm patients, I really have to look in there. And sometimes you'll identify really large granulomas that...
Under the tongue sometimes, right?
Or on, like, at the base of the tongue, like in the back, and the family will have no idea. They'll never have seen it. The cat's not dropping food. They're eating well. Sometimes they have a little bit of halitosis, but...
This cat was actually having a problem with his eye. the thing had gotten so big. So
Oh,
I was sure it was a
wow.
tumor, and I was, they were
Go
like,
away.
no, take it out.
Now, I have not seen one that bad.
It was just one of those weird.
I need a
Wow.
picture. You have to send me a
I
picture.
don't know if I have any, but I'll have to look
man.
and see.
Now, Kelly used to work with me, and one of my rules is take pictures.
Yes.
So,
Yeah. Those
Yeah.
were early days.
yeah.
And I take pictures of everything.
Yeah.
So easy with our phones.
Yeah.
Yeah.
Well, we veered away from Nat Geo, right? So,
Yeah.
8 episodes?
We had 8 episodes in one season, and
Where was it
it was really
filmed?
fun. It filmed in Louisville, and what was interesting is that the clinic that I was originally in did not allow filming. It was owned by a corporate group, and so I finished the business day on a Friday, shut down the clinic, packed it up, and moved on a Saturday, and we started filming on Monday. So we everything that was filmed was in a brand new space for us. We ended
Okay.
up finding a general practice vet that was local that had a lot of extra space, a really big clinic, and he was a solo practitioner, and he was happy to have us come in. So I basically just came in like gangbusters, set down shop, and we started filming and practicing again on Monday. And we had some fake real signage that was
Yeah.
put up on his building, but then taken down later. And so people, when they would come to visit, they'd say, I don't see, it doesn't look the same. And I was like, oh, well, was a pseudo sign or a temporary sign.
temporary.
But it was really, really fun. Like I enjoyed it. I enjoyed getting to know the crew, and still have some good relationships with them now. And yeah.
Do you record like all of the episodes at once?
So the filming is really interesting because you do like a staggered filming schedule. So you film 4 or 5 weeks, then you have a little break, and then you come back and film for 3 weeks, and then a little break, and then you come back and film for 1 or 2 weeks. And then they come back and do pickups. So months later, after they have sourced all the episodes together, they'll come back and do little interview sessions like this and ask you, well, what did you think about Fluffy, and what was going on with that pet? And, and so those are fun. The hardest part of all of it was the long days, because you film, probably 12, 13 hours a day, much longer than what we usually are open. And so that was hard. And, I had very small kids at the time, and then we would film on Sundays as well. So we filmed 6 days a week. The Sundays usually was me standing for 6 to 8 hours doing all of those interview scenes when you see like the television vet and they're standing there and they're asking about what you think about the case, and you're just standing, in one spot or sitting in one spot.
Right.
Those were filmed in long segments.
Now that I'm thinking of some reality shows now, that makes sense to me.
Yeah.
Yeah, because there's
Yeah.
a similarity to those little bits.
Yes.
So that's why. Okay. Yeah.
And it's always amazing to me how much content they have to film for a small amount of whatever
A
they
lot.
put together. Right?
Yes. So there were things that we filmed that I thought were really amazing and cool, and they didn't make the cut.
Yeah.
And that it could have been for varying reasons. Certain species, they don't transfer to camera very well. So those were we did some large animal things that were kind of cut out.
No.
Yeah.
No way.
Some really crazy large. There was a calf that was brought in a minivan that I lanced an abscess
in a
on.
minivan.
In a
Bovine
minivan.
abscess.
I never thought I'd ever say those words together.
Really nasty,
Yeah,
right? The
bovine
bovine abscess were ready to cut it, but they couldn't. There was no good way for the family to transport this calf, so the production team went out to her farm, and they had a minivan, and they took the seats out, and the calf was in the back of the van. I have videos of it, just didn't make it to television, but in the back of the van. And the production team that was driving it was just a young girl from California, and she's like, yeah, I'm just driving with this cow in the car. I hope the rental company doesn't get too mad about all the
manure.
mess.
Yeah.
Correct. They turned it back in somehow. The van went back.
That is crazy. I guess I'm sad the cow didn't make the cut.
I know. I thought it would have been really great to see it pop out of that
those
minivan.
are the best kind of abscesses too when you're lancing those. So.
Did you did some large animal or no?
When I first graduated,
Yeah.
for about 9 months before I came to work for you.
Okay,
I used to do dairy work, so
Oh, yeah.
those were always the ones you wanted to have the students just stand right there.
Yep.
You're right in the
So
line
exciting,
of fire.
though. That's
Yeah.
like so impressive. Such an impressive abscess.
But but when you're filming, you're working with animals, and that must bring its own complexity, I'm guessing,
yeah.
right?
Yeah, they do. So a lot of them are our own patients and clients, and then some were kind of brought in from casting, and so they'll send a big message out that we're filming this show. If you've got any weird or unusual, or just things that haven't resolved, can you send them in? And they were looking for certain types of cases because they did really want things that had a little bit of shock factor,
little drama.
But I do see a lot of shock factor in my day to day. So it really is just but it, that ebbs and flows with what's coming in that week. So we worked really hard to get the kind of visually exciting things in for TV, but
the clients who came must have been excited.
Some were excited. Some did not want to be on camera.
Okay.
So there are people that's not.
But
their
they would
thing.
let their pet be on.
They
but
would
not
let
themselves.
they would call it a patient only. So, but they really wanted the pet parents on there if possible because you want to know the story behind the pet and how this skin disease affected their quality of life and why it's important that we get it better, and that emotional human-animal bond connection. They really wanted those stories. So if it was an animal only, sometimes those cases didn't actually make it to television either because they really wanted to know, well, how do you feel about your pet and all of that.
Have the humans involved.
Yeah.
So there must have been some funny animal other than the calf in the van. There must have been, because the patients don't come from casting, right? Like they're going to do their own thing. So
yes.
Did they deliberately look for animals who would be more easier to film and less likely to be upset, or did
there was a lot of different species. We had a goose that we filmed, a skunk and an armadillo, a chameleon. That was actually a referred case, so that one came from the community. So we had a lot of exotic species, and then we did film at the Evansville Zoo in Evansville, Indiana, and had a couple animals there that were originally filmed.
Oh my gosh. Oh my, what do armadillos get?
So they don't usually get anything.
Okay.
A lot of it would probably be related to, I honestly don't know.
Right.
I mean, I didn't learn that in school, but this particular armadillo belongs to a good friend who owns a non-for-profit wildlife rescue, and so apparently there's armadillos in Kentucky. Like, I didn't know that until I met Archie the armadillo, and so he came in and he was losing his scales, so we actually termed it scaleogen instead of telogen, and it probably was some sort of stress response. He had been ill several months prior to him starting to kind of avulse and just shed off his scales, but it was really prominent, and then they would grow back healthy scales, and so there was no way for me to really biopsy the shell, so it was just sort of a presumption that had to happen. But it was really cool. It's fun to see.
He was a rescue armadillo?
Yes. Yes. Really kind.
I had no idea.
So sweet. She has a lot of wildlife critters that if she can't rehab them to put them back into the environment, then she will keep them. It's called second chances if you want to look at it. But
chances.
They are adorable, and they do a lot because it's really important for our ecosystem to get those wildlife species back into where they belong. Yeah. We really shouldn't keep them as pets, and we should. Yeah, that's not recommended, but
right.
He was a pet.
So armadillo, chameleon.
Yes.
What else did you?
We did a goose, and then
the goose. What did the goose have?
It had bumblefoot.
Oh.
So the abscessation that they get.
Yeah.
So geese can get that.
Yes.
Okay.
Yeah, and it can be related. It was, the unfortunate thing with this goose was that it had created a really firm granuloma around it and scar tissue, so we really couldn't lance it at that point. So, but they just get wounds, and then the body does a really good job walling it off, and then it just stays, a little kind of interdigital. It was almost like an interdigital bullae or cyst that you could see. Yeah.
Right. Wow. Gosh. We've strayed from cats, but my gosh, I mean, it's fascinating.
Yes.
So in your daily practice life, do you see a fair bit of what we would call exotic species?
From time to time, I do. I'm open to it, so I would, we have a relationship with the Louisville and the Evansville Zoo. So we actually, a big cat, we treated a jaguar at the Evansville Zoo that had atopy.
A jaguar with atopy?
Yes, and he unfortunately had an accident years before where he lost a part of his tongue, and so it was really hard for him to be medicated. So they had to crush his, at one point, cyclosporin. They had to put that in like a slurry to feed him, and then he was on oclacitinib at one point as well, or Apoquel. So that it was really interesting.
Sounds like a lot of
trying
Apoquel
to.
Yeah, in my head I'm thinking,
A lot.
how much cyclosporin does it take?
A lot.
Yeah.
Same doses that we would use in a domestic
Just
cat.
a lot.
Just the volume quite high and very expensive, but they were willing, to do it for him because he was pretty miserable. His allergies made him pretty miserable.
Oh, poor guy.
So, yeah.
And so, did he get better?
He did get better. I do believe he was also on immunotherapy too,
Okay.
so that was helping to manage his skin disease quite well. And he I never got to examine him hands-on unless he was sedated. But
Sure.
I always would come and see him and take a look at him from a safe distance.
So, you were able to identify an allergen then?
Yes.
Yeah. So, something, was it seasonal or?
He had a mixture of pollen allergens that I can't remember exactly what he was allergic to, but
yeah. I don't know
Pattern
why
of
it astounds me that big cats would get the same things that little cats do, but
Do they get eosinophilic granulomas?
I haven't seen that yet in the patients that are in our 2 zoos that we associate with, but I would imagine that they could.
Yeah.
And I haven't seen any reports, but I don't know if I've ever looked for a report of eosinophilic granuloma in a lion or anything like that. Now I'm going to go back and look and see.
Yeah.
Let you guys know. I'm sure they could. A lot of things with the zoo animals that they do come across as it's husbandry issues for the most part, but I'm sure that they could be allergic just like any other cat.
yeah. And so, the other show you filmed was for Discovery, is that right?
No, the Pop Goes the Vet was originally a Nat Geo Wild show, and then it's also streaming on Disney Plus.
Oh, and Disney Plus. Yeah. So people could watch it on Disney Plus now.
You can still watch it.
Oh, that's very cool. Okay,
Yes.
so in our show notes, we'll be sure to put a link, and also for your friends, the Second Chance Rescue. We'll put these
thank
links in
you.
our
That'd be
show
wonderful.
notes. Yeah. It's a unique experience.
It
isn't
really is. I mean, I think the biggest thing that I loved about the show that was pretty unexpected. I mean, I really went into it just with an open mind. I thought this would be fun. It would give us exposure to, people in general about our company, Animal Dermatology Clinic, but about the dermatology as a profession, that we're here, we exist, we can help you with your skin cases, to our pet parents. And then it actually opened up a lot of opportunity for mentorship for children. And I have small children. I just love kids, and there's been so many children from age 3 on up through high school and college that have come and rotated our clinic, that have said, you've made me interested in becoming a veterinarian or even in a veterinary dermatologist, and that's been really special. I didn't expect that at all, and I don't know if I just look like Doc McStuffins or I'm not sure, but a lot of children really identified with this show, and so I don't know if it's because it was on Disney Plus as a platform, but a lot of kids have reached out and just said, I really love this show, I want to be a vet, or their parents are reaching out, and that has been super meaningful.
Sounds
and
like a lot of
it
fun.
matters.
I bet you didn't expect that.
I didn't at all. I did not at all. And so that's been really fun. And we have a pretty open door policy in our practice, so kids can come and shadow. And depending on their age, if they're really little, they just come with their parents at the end of the day, show them around, kind of like a little tour. And if they're older, they can stay for half a day or whatever they are wanting to do. And it's been really fun.
Wow.
Some of that's been shocking for some. You haven't had anybody pass out or anything?
Yeah, it's interesting that you asked that. So one of my clients has two little dogs that we treat, or 2 little small animals, and we treat them. And her daughter's named Olivia. Hi, Olivia, if you're listening.
Yay.
And she has shadowed with me a couple times and come back just to see what we're doing with her pet, but then also stayed for a few hours. And we had a patient that reminded her of her own pet, and she said, this just makes me feel anxious and nervous, and nothing bad was really happening, but we were doing a video otoscopy procedure, scoping the ear, and she said, I just want to wait out here. And it wasn't even really that gross. It just made her think of her own.
Oh.
Yeah,
So she wanted to.
Very emotional.
Yeah.
She wanted to just take a break from it. So.
Right.
Yeah.
Right.
It's understandable.
Right.
Yeah.
So, along the line of getting veterinary dermatology better recognized. So I would assume that you feel it's not a well-known specialty.
I think especially amongst clients and pet parents. I think specialty medicine in general, amongst pet owners, they don't really realize that, if you have an eye problem, that you could go to an ophthalmologist, or if you have, your dog needs a major surgery, you could go to a surgeon. I think they don't actually really realize that, because, general practitioners can do a great job at all those things. But sometimes things get a little, more complicated, or they just don't realize. And so I think that it's nice that they can have an idea of that. And then as far as just from a veterinary aspect, or for students, I think they don't realize as well the breadth of opportunities we have in our profession. Yeah. Lots of different options for you. So they can only know what they see. And so just having that visibility of knowing, there are other options, even teaching that you could do. And maybe television vetting.
Yeah.
I mean, probably not, but maybe, it's just like, the sky's the limit, I think, in veterinary medicine. And, we have there's like a little bit of a pigeonhole with what I think people think vets do and who they are, and it's a lot bigger than that. And, feline specialists, like, that's even bigger. And like, people don't really realize that there are those niche kind of things that we do. And I mean, especially with cat medicine, I think, it's really important that you have someone that likes cats and that knows their kind of nuances and, the diseases that they have, because they are very different than other species, for sure.
Yeah. Yeah, and I think for someone like you, it's a great advantage because you grew up with cats, right? So I learned the hard way never to hire a vet who has never owned a cat.
Yes.
I've learned that the hard way. Because you don't know what's normal, you don't know what to ask.
Yes, and I think, it's one thing that I think that gives you a little bit of buy-in as a cat owner myself, is that I can really commiserate with people. Yeah. I can say, hey, my kitten, and this is a true story, my ragdoll ended up with a weird uveitis as a kitten, and he needed drops multiple times a day, and he wanted to bite the mess out of me. Yeah. And it was impossible. I could not do it. My husband had to do it, which meant he did it most of the time, and then he would kind of fall off like we all do with treatments. And so, I always give those anecdotes just to say, I get it. I understand why it's hard for you to medicate or do these drops or do really the ear meds, anything to a cat. Like, I totally get it. I understand. And I think they when you can identify with them and get them off the hook, because people feel like, you're judging me, or, I had a lot of cats. I think at one point we had 14 cats.
Oh my.
Mostly kittens, though.
You've been there, done that.
Yeah. Mostly kittens. But I totally understand it. I have no judgment on it. I want more cats. Yeah. But my husband won't let me. So
I think you've hit on something that's kind of dear to me, too, and that is moving away from the relationship with a client where, like, I'm the professor and you are student and you must
do what I say.
Complete this task.
Yes.
Right? Because I think we kind of started like that. Mm-hmm. And the shift, hopefully, is going in the right way, where you need to find out what your client and what the cat can do.
Yes.
Right? It, like, what we want is one thing, but what they can do is another.
And that's really, it's more collaborative. It's really a relationship and trying to figure out what works. And I try to offer as many solutions as I can that may, because a lot of times, unfortunately, some of these severe allergic cats, they do need drug therapy, and administering the drug therapy is tricky. And so we just talk about different options and how we can try to get that done. And if they cannot medicate at all, then immunotherapy is going to be a better bet for us long term to try to get them off of those chronic oral meds, because that's not always possible. And then of course there's risk of side effects and all of that. So I'm a big fan of immunotherapy in itchy cats, because then eventually, once it works, we can hopefully stop having to give them steroids and stop having to give them cyclosporin and things that they're running and hiding. And I've had pet parents tell me, I cannot do that med anymore because it's destroying my relationship with the cat. Right. And I get it. It's hiding, it's biting, it's stressful. And so I totally understand that. I try to offer them some different things.
I think it makes a difference if you can see yourself in their shoes, right? You know, if you can think, oh my gosh, if I had to do this for like my cat, I'd be just like you. I
wouldn't be able to do it. If you asked me to do a diet trial for my cat, I would laugh at you and tell you goodbye. Sorry, sister.
And you're the dermatologist.
Yeah. I mean, if I really had to do it, the cat would have to live in a separate space in the house. You know, because they get in the sinks. They get on my counters. I can't say for sure that they're not eating their pet's food.
Exactly.
And I think
that's just a real world.
I think that makes a big difference. I really do, right? It's like if you've ever owned a diabetic cat, then all of a sudden you have a new understanding of what that means.
Yeah,
right?
You can commiserate really well.
Yeah. And especially a lot of veterinary dermatology management it's a slow process, right?
It can be. And there's, atopy, if that's really a disease in cats, or feline allergic skin syndrome as we're calling it, it is a diagnosis of exclusion. And so you have to get the buy-in on consistent flea control. I'm sorry, but that can be really challenging in our cat parents, and challenging for myself. I don't consistently give flea control to my indoor cats. I should, and we found a tick in the house, and I have a cat that goes out, and I swear it was him. It may not have been, but that night it was a flea control party. Like everybody was getting the meds that I had for months, and in a bucket somewhere, and then everybody was getting their flea control. But I understand because I am that cat person.
That's the real life, isn't it?
I am that cat person. So I totally understand.
I think that's a good point to end on. Actually, it's been just so much fun having you on, and I hope that you'll agree to come back with us like another day. And,
I would love to. We can pick one topic and talk about it, or whatever you guys want, or just laugh about cats.
Our prep for this is like zero. It is really.
I like it though, because you still touch on a lot of things.
It's just been our modus operandi from the beginning, right? That there's no script, there's no questions. We just want to see where the chat goes, and it always goes into interesting places.
So much fun.
It is.
This is the Purr Podcast, where we talk cats, laugh a lot, and learn something new every episode. Together, we bring you the latest updates, surprising cases, expert interviews, and just a touch of chaos, because nothing with cats ever goes as planned.
So whether you're a seasoned veterinary pro, a new grad, or you're just here for the cat puns, you've come to the right place.